So a lot of people are asking about what's going on with Robert Kennedy Jr.'s voice. And you may be wondering, well, why doesn't he just fix it? That's a great question. So let's take a listen.
I think that the general theme of my speech was this corrupt merger of state and corporate power, which is turning our country into a corporate kleptocracy, into a system of socialism for the rich, and this kind of a cushy socialism for the rich, and this kind of brutal, merciless capitalism for the poor. It keeps
So what we're
us in a
hearing
state of
here is a
war. It
voice that
bails
sounds
out banks
hoarse
at
and
the same
strained,
time that
almost like it's involuntarily being cut off, right?
the United
And
States
what could cause that?
government told
Well,
30
Robert
million
Kennedy
people
Jr. has
in
been really open about the type of voice disorder that he has, and it's called spasmodic dysphonia. Now, as somebody who specializes in working with singers, actors, and other high-level voice users like politicians, I have to tell you that unfortunately, SD doesn't have a cure. Now, spasmodic dysphonia, or SD for short, is a rare type of neurologic voice disorder, meaning that it affects the nerves that make the voice work. Now, it usually develops in adulthood and affects women more than men and can worsen over time. The severity of the condition varies widely. Now, the exact cause is unknown, but voice researchers think that it may be caused by problems with the basal ganglia. Now, that's the part of your brain that helps coordinate muscle movement. It's really important to note that SD interferes with the delivery of the message, not the cognitive process of actually creating the message. Now, treatment options often include injections of Botox into the spasming muscles to decrease the symptoms of SD, but since we also use some of those muscles when we swallow, it's a really delicate dance to inject enough Botox to help reduce the spasms without over-weakening the muscles to the point that we're coughing and choking when we're eating or drinking, or our voice is reduced down to a whisper. So you see the challenge here. It's a really tricky disorder to treat. So once the Botox is on board, a voice specialist SLP, such as myself, can help with vocal strategies and techniques to help you maximize improvement. Now, depending on the severity of the SD, completely fluent speech typically isn't possible. So if you or somebody that you know is experiencing these type of voice symptoms, you should make an appointment with a laryngologist and a voice specialist SLP for diagnosis and treatment options. Thank you. I'm Dr. Joanna Slogie, and you can check out my bio in the description for more information about voice disorders. Or if you have any questions, please comment below, like, and share and subscribe. Thank you.